Hi, this is Keith. This presentation goes along with Chapter 13. So if you haven't read that yet, it's a good idea to read that chapter first and then watch this presentation. And please keep in mind that the lecture is intended to supplement the material in the chapter. The chapter has much more information, and the quiz will be based on the material in the chapter. In this presentation, we'll discuss issues of sexuality related to perfectionism, substance use, disability, sexuality and cancer, and a few additional sexual health issues. All right, let's begin by discussing what our culture defines as sexual health and the ideal body. Definitions of sexual health tend to acknowledge two broad elements. First, that sexuality or relationships with a sexual or romantic component have intrinsic value as part of health. Now, this means that sexuality and sexual health are not just an end in themselves, rather, they are important components of overall health and well being for people. The second is that healthy sexual relationships require positive experiences for individuals and their partners. Now, the second factor acknowledges critical issues related to consent, open discussion about sexuality, and considering the needs of all persons involved. Most of what we'll talk about in this chapter has to do with how our health impacts sexuality and our sexuality can impact our health. Now, we know that good health requires us to know and understand our bodies and to feel comfortable with them. Now, this might mean feeling at ease with the sight and feel of your vulva and to be comfortable with and aware of your breasts, or accepting your penis and being aware of physical sensations such as lower back pain or a feeling of congestion in your bladder. Overall, our general health affects our sexual functioning. So let's talk about some things that can really impact overall sexual functioning. Eating disorders have a large impact on our sexuality and sexual health. Eating disorders are defined as serious and often fatal illnesses that cause disturbances to a person's eating behaviors. Eating disorders encompass a wide variety of different behaviors from having obsessions with food, body weight, and shape, but it can also include obsessive thoughts about healthy eating, compulsive overeating, over-dieting, as well as starvation and binging and purging. Most people with eating disorders have certain traits, including low self-esteem, perfectionism, difficulty dealing with emotions, unreasonable demands for self-control, negative perceptions in self and relation to others, and fear of being overweight or fat. Also, the emergence of pro-eating disorder websites has been tied to increased rates of eating disorders. And it's important to know that eating disorders impact almost all groups. They affect about 9% of the general US population. And eating disorders are found in all racial and ethnic groups, as well as disproportionately impacting sexual and gender minority communities. Eating disorders have a very high mortality rate. In fact, it's the highest mortality rate of all mental illnesses. A study by Kvalum and colleagues in 2019 conducted in Norway found that adolescents' body satisfaction predicted adult sexual satisfaction. So the results of this research suggested that adolescence is a significant period for establishing a body image. Another factor that may impact sexuality is substance use, which includes alcohol and drug use. There is a strong belief that alcohol and sex go together, which is reinforced by popular culture. Think of how many beer ads include aspects of sexuality, such as showing attractive people in bathing suits. Adolescents may be particularly susceptible to seeing this type of imagery in popular culture and attempt to model it. And a massive number of studies have shown that combining alcohol and sexual behavior is associated with sexual risk and acquiring sexually transmitted infections. And it comes as a surprise to no one that alcohol use among college students is very common. And unfortunately, its use is associated with sexual assault and sexually transmitted infections. Now, one of the reasons why alcohol is associated with risk behavior and negative outcomes is through the process of disinhibition. This refers to findings that under the influence of alcohol, behaviors that would normally be suppressed are actually activated. So, when we're not intoxicated, our brain sends signals to us to avoid doing things that are clearly going to be harmful or not appropriate. But alcohol disinhibits those executive cognitive mechanisms and can lead to poor judgment, riskier behavior, or illegal behavior. or all three. In addition, alcohol affects the ability of individuals to become sexually aroused. So if you have a penis, consuming alcohol may lead to difficulty with getting or maintaining an erection. If you have a vulva, then alcohol consumption may reduce or restrict the ability to produce vaginal lubrication. And for almost all people, physical sensations are likely to be dulled under the influence of alcohol. And of course, alcohol has been linked to increased risk of engaging in risky behaviors. That includes condomless sex. And that can lead to exposures to sexually transmitted infections, HIV, unwanted pregnancies, and sexual violence and intimidation. Okay, let's take a look at a few other types of drugs. So, marijuana users frequently report that it increases frequency and enjoyment of sexual encounters. And there are definitely studies that show that marijuana users have slightly higher frequency of sexual activity than people who don't use marijuana. So, it appears that marijuana does not seem to impair sexual functionings. And it's really one of the few drugs that don't show that it impairs sexual functioning. Many substances are considered an aphrodisiac by people who use it. By aphrodisiac, we mean substances that purport to increase sexual desire or improve sexual functioning. However, most recreational drugs actually have the opposite effect, especially because many substances interfere with sexual functioning. So let's take a look at a few. The first is amyl nitrate, also known as poppers. Now, poppers can have the effect of increasing blood flow to the penis, vagina, and anus, and thereby increase sexual pleasure. However, when combined with erectile dysfunction medication like Viagra or Cialis, poppers can dangerously lower blood pressure, which may be harmful or in fact fatal in some situations. So again, poppers should not be combined with erectile dysfunction medication. In addition to poppers, there are stimulant drugs that include drugs like cocaine and methamphetamine. Now, while they increase sexual desire, they can also interfere substantially with sexual functioning through not being able to achieve an erection. Now, methamphetamine is especially associated with increased risk for HIV infection and infection with other STIs among sexual minority men. Another is ecstasy. So, ecstasy is unusual because it's both a hallucinogen and an amphetamine, and typically has the effect of increasing sensation and empathy. However, ecstasy is associated with not being able to get an erection, although it is associated with increased desire. Finally, there are a number of supplements that purport to increase sexual arousal and functioning, although there is little research to support these claims. Okay, let's move on to a different topic, which is sexuality and disability. So, nearly 13.5% of Americans are living with a disability in 2021. Having a disability or chronic condition does not inevitably mean the end of a person's sexual life. However, common myths persist in our society that shape our beliefs about persons with disabilities. Some of these myths include that people with disabilities are less sexual, or sex only means penile vaginal sexual intercourse. Another myth is that among those with disabilities, talking about sex is unnatural, improper, or unnecessary. Sex is for younger people who are able-bodied. Another myth is sex should be spontaneous, and that a firm penis and an orgasm are requirements for satisfying sex. So we know that sexual expression is a component of personality, and it is totally separate from whether someone can achieve an erection or their fertility status. So those are some of the myths. So let's talk about some of the realities of having a disability and sexuality. So many people are subject to sexually limiting conditions. These conditions may be congenital, appearing at birth, such as cerebral palsy and Down syndrome. These conditions may also be due to spinal cord injuries. So with spinal cord injuries, the effects on sexual response are usually associated with the degree and location of the injury. For example, while people with upper spinal cord injuries often have difficulty with ejaculating, spinal cord injuries that occur lower in the spine are associated with a better chance for ejaculation. Now, in any case, people with disabilities must overcome previous sexual functioning expectations and realign those expectations with their actual sexual capabilities. This often means finding new ways and methods for sexual pleasure that may not include sexual intercourse or penetration. It may include increased arousal to touch or sex that emphasizes oral or manual stimulation rather than penetration. But as we talked about in a previous slide, people who acquire a disability may hold preconceptions about sexuality that are negative beliefs about people with disabilities. So they sort of have to learn to overcome their own negative beliefs about people with disabilities. Another consideration is to think about sexuality among people with developmental disabilities. So, people with developmental disabilities most often have problems with major life activities such as language, mobility, learning, self-help, and independent living. The capabilities of persons with developmental disabilities can vary widely, so it's really impossible to say what type of sexual education should be given since each person is really different. And as such, sexual education should be tailored to the needs and capabilities of the individual. Now, unfortunately, persons with developmental disabilities are at 3 times greater risk of being sexually abused than non-disabled peers. So, for this and other reasons, sexuality education, especially during adolescence, is extremely important for persons with developmental disabilities. But sexuality education for persons with developmental disabilities is often left to caregivers, since very few states actually include special education students in their sexuality education requirements. So again, that's sort of left up to caregivers or other important people in their lives. Now, the loss of sight and hearing can present difficulties in both theoretical and practical ways, and in our understanding of sexuality. By theoretical understanding of sexuality, we mean that persons born with a hearing loss may not experience or understand, for example, what sounds are usually associated with sexual arousal. However, these difficulties often can be overcome with education or counseling, depending on the circumstance. There are schools and programs for children who are sight and hearing impaired, and they offer specially designed curricula for teaching about sexuality. Okay, so let's talk about sexuality and chronic illnesses. So, chronic illnesses can require considerable adjustments. This may come in the form of accepting the limitations compared to what someone was able to do before the illness, as well as possible negative feelings about their own sexuality and bodies after the onset of the illness. So, for example, diabetes mellitus, or just diabetes, may lead to nerve damage or circulatory problems that can cause sexual problems, such as obtaining an erection. Cardiovascular disease may lead to heart attack or stroke, which will affect important aspects of daily living, and this also might cause fatigue and a loss of libido. And then chronic lung disease affects many aspects of a person's breathing and severely limits daily activities. So persons with chronic lung disease can have difficulties maintaining an erection and having an orgasm. Overall, living with a chronic illness can require considerable adjustments. However, in many cases of physical limitations, education and counseling can overcome problems with sexuality associated with that limitation. So it's important to know that people with disabilities have sexual rights, and those should be similar or the same as persons without disabilities. So these rights include the freedom of sexual expression, the right to privacy, the right to be informed about and have access to needed services, the right to choose one's marital status and whether or not to have children, and the right to make one's own decision and develop to one's own full potential. All right. So we talked about quite a few different types of illnesses that might impact sexuality. We're going to spend some time talking about sexuality and cancer. So cancer is a collection of related diseases in which some of the body's cells continually divide and spread into surrounding tissue. The commonality in all forms of cancer is that they are the result of aberrant behaviors of cells. Now, this aberrant cell growth can cause benign tumors that are slow growing and remain quite localized. However, tumors that invade nearby tissue and disrupt normal functioning of organs are called malignant tumors. These are the type that are cancerous and often fatal. Metastasis is the process by which the disease spreads from one part of the body to another unrelated part of the body. In any case, both cancer and a cancer diagnosis can have a devastating effect on a person's sense of self, including their sexuality. For this reason, many providers have recognized the long-term impact of cancer, that it may and that it may be affected by education about the disease and its effects, and compassionate social support. So those are important aspects of managing cancer after the diagnosis. We'll first talk about cancer among females, and then later on we'll talk about cancer in males. So, for women, most lumps and bumps are benign conditions, although finding a lump in the breast can cause significant emotional distress. Most lumps are the result of uterine fibroids, ovarian cysts, and fibroadenomas of the breast. Excluding cancer of the skin, breast cancer is the most common cancer in women. Studies show that about 1 in every 8 American women born today will be diagnosed with breast cancer sometime in her lifetime. Now, lesbian and bisexual women should be especially aware of cancer prevention options, since historically they get less routine health care, including cancer screenings. And postponing such tests can result in later diagnosis when cancer may be less treatable. The most significant risk factor for cancer is age, with older women getting cancer more so than younger women. But many other risk factors also increase the risk for cancer, and those include inherited changes in certain genes, such as BRCA1 and BRCA2, having a personal or family history of breast cancer, having dense breasts, menarche before age 12 or menopause after the age of 55, not being physically active, after menopause being overweight or obese, taking certain hormones, having a history of breast cancer or certain non-cancerous breast diseases, having taken the drug DES, which I am not going to try to actually say what that means. You can see it on the slide, as well as drinking alcohol. Now, early detection is an important part of preventative care. Breast cancer can be detected in a number of ways. There are two types of mammograms to be aware of. One is sort of a basic mammogram, and this is an X-ray of the breast. And this has been probably the most widely used way to find breast cancer early. There's also a newer type of mammogram called a 3D mammogram, and it's an imaging system that combines multiple breast X-rays to form a three-dimensional picture of the breast. Again, it's important to know that most breast lumps are not cancerous, and many disappear on their own. Most are related to fibrocystic disease, a common and generally harmless condition, or, as I mentioned before, are fibroadenomas, which are also harmless. But it's still important to detect these conditions as early as possible. Now, if a tumor is found, most women undergo some type of surgery to remove it, and there are several options. So, breast conserving surgery, or lumpectomy, is the removal of only the breast lump and some normal tissue around it. So, again, the idea is it sort of is conserving the largest amount of breast tissue while removing the tumor. In contrast, a mastectomy is where all the breast tissue is removed. So, whichever option is chosen, it may be combined with other treatments such as chemotherapy or hormone therapy. Now, following a mastectomy, many plastic surgeons and oncologists suggest having breast reconstruction surgery. However, for some women and people with breasts, the right choice for them is to remain without breasts, and this is sometimes referred to as going flat. Now, there are other forms of cancer that are less common than breast cancer, but still important. And those are cervical cancer and cervical dysplasia. So, cervical dysplasia, or cervical intraepithelial neoplasia, is abnormal growth on the surface of the cervix. So, this is considered precancerous and can become cancer and spread if not treated. Now, in contrast, cervical cancer is malignant cancer and can spread if it's not treated. Risk factors include having had sexual intercourse before the age of 18, giving birth at a very young age, having had multiple sexual partners, having another illness such as diabetes or HIV, using medications that suppress the immune system, and smoking. The most reliable means of early detection of cervical cancer is a Pap test, or commonly called the Pap smear. This is usually done during a pelvic exam. If abnormal cells are found, the Pap test is followed by a colposcopy, which is a medical procedure used to examine the cervix for abnormal cells or other conditions. If an abnormal area is seen on the cervix, then a biopsy is performed that involves the surgical removal of the tissue for diagnosis. And then, if the biopsy shows abnormal cells, then the treatment usually involves removal of the abnormal area. Now, in very rare cases, does the cervix have to be removed altogether? Okay, so in this figure, you see a pap smear test and a pelvic exam. So on the left, the pap test involves inserting a speculum into the vagina to maintain an opening, while a spatula is used to scrape a sample from the cervix. Now, during the pelvic exam shown on the right side, a manual exam is done to evaluate the reproductive organs in addition to the pap test. Okay, so in this table, you see the screening guidelines for early detection of breast cancer for females. As you can see, there are slightly different recommendations depending upon the organization making the recommendation. But let's just focus on the U.S. Preventative Services Health Task Force recommendations, which is the second column from the left. This task force notes that having a clinical breast exam for all women of all ages is not recommended because there is insufficient evidence for or against doing this. For women ages 40 to 74 with average risk, they recommend getting a screening mammogram every 2 years. However, after the age of 75, there isn't enough evidence to recommend routine screening. They also note that there isn't enough evidence to recommend supplemental screening in addition to mammograms for women with dense breasts. Now, persons with higher than average risk for breast cancer may benefit from starting screenings in their 40s, but the frequency and type of screening tests should be discussed with their healthcare provider. Okay, another form of cancer is ovarian cancer, which typically begins in the fallopian tubes. It is more aggressive than other types of cancers because it is difficult to diagnose in the early, more treatable stages. The odds of a person getting ovarian cancer during her lifetime is about 1 in 87. Endometrial cancer starts when the inner lining of the uterus begins to grow out of control. Now, in some cases of cancer, a hysterectomy may be recommended, which is a surgical removal of the entire uterus. A hysterectomy may be recommended for reasons other than cancer, however, but that's just one reason. Now, the effects on a woman's sexuality following a hysterectomy can vary. For example, some women may get scar tissue as a result of the hysterectomy, which could lead to pelvic pain. However, the majority of women who have a hysterectomy report either no change or improved sexual functioning following the procedure. Okay, let's turn our attention now to cancer among males and the impact on their health. So, studies show that men are generally less likely to get regular checkups and seek help at the onset of symptoms than are women or females. This is unfortunate because early detection can often mean the difference between life and death. So it's really important that men pay attention to what goes on in their genital and urinary organs, as well as the rest of their bodies. Among American men, prostate cancer is the most common form of cancer, excluding skin cancer. 1 in 8 men in the US will get prostate cancer in their lifetime. Fortunately, prostate cancer is relatively slow growing, which is good since often there can be no symptoms. However, when symptoms do occur, they can include urine flow issues, difficulty in getting an erection, blood in the urine or semen, continuing pain in the lower back, pelvis, hips, or other areas. Symptoms can also include weakness or numbness in the legs or feet and loss of bladder control. Now, risk factors for prostate cancer include aging, a family history of prostate cancer, being African American or Caribbean, um, or of African ancestry, as well as gene changes. Now, there are easy ways to detect for possible prostate cancer. The most common is through a blood test to detect prostate-specific antigens, or PSAs. However, this test can be a little bit tricky to interpret since PSA levels can be elevated in men with a benign condition called prostatic hyperplasia. Also, the PSA test can't really distinguish between aggressive and mild forms of cancer. So it's a little tricky to figure out if you get an elevated PSA level, whether it's a serious concern or not. The treatment for prostate cancer can include surgery, hormone therapy, radiation, chemotherapy, or a combination of these. And because prostate tumors are small and slow growing, many men elect to just kind of wait and see how the prognosis goes rather than have treatments like surgery right away, since things like surgery can have really quite negative effects on men's sexual health. Okay, so on this table, you see screening guidelines for early detection of prostate cancer according to different organizations. Again, I'm going to focus on the U.S. Preventative Services Health Task Force, which is shown in the third column from the left. Essentially, the only age group where a PSA test should be considered is between the ages of 55 and 69, where it's an individual's decision to get tested, their PSA levels tested, and that's made in discussions between the patient and the healthcare provider. The PSA test has a relatively high false positive rate, such that the test may suggest someone has prostate cancer when they actually really don't. So testing could result in a lot of emotional distress for no reason if they get a false positive. So again, that's why in many cases, and because prostate cancer is slow growing, that there isn't a recommendation, according to the U.S. Preventative Services Task Force, to screen for prostate cancer. But as you can see in the column on the far right, the American Urological Association recommends much more routine testing. Okay, another type of cancer among males is testicular cancer, which is less common than prostate cancer, and thankfully, treatment is usually pretty successful if detected early. Most cases can be detected at an early stage by the discovery of a painless lump or slight enlargement or swelling of the testicle. Now, treatment options for testicular cancer include surgery, radiation, chemotherapy, and chemotherapy with stem cell transplants. The loss of a testicle may be felt as a threat to masculinity and can therefore have an impact on on a person's sense of their sexual health and sexuality and overall quality of life for survivors. However, it should be noted that the remaining testicle usually can make enough testosterone to keep a man healthy and able to reproduce if that's important. Okay, I also want to mention breast cancer among males. So, to put this in perspective, while breast cancer does occur among males, it is about 100 times less common than among females. And most breast disorders among males are benign. However, risk factors for breast cancer in males include aging, family history of breast cancer, heavy alcohol use, inherited gene mutations, as well as others. And symptoms can include a lump or swelling in the breast, skin dimpling or puckering, nipple retraction, redness or scaling, and potentially discharge. Now, as with breast cancer in females, diagnosis involves one or a combination of clinical breast examinations, mammography, ultrasound, MRI, nipple discharge examination, and/or biopsy. Now, if found, treatments include surgery, radiation therapy, and chemotherapy. Another type of cancer that affects all people is colorectal cancer. It starts in the colon, a long tube-like organ in the abdomen and the largest part of the large intestine, or the rectum, which forms the part of the digestive system and links the gastrointestinal tract to the anus. Now, risk factors that have been associated with colorectal cancer include being overweight or obese, having type 2 diabetes, having a low fiber and high fat diet, smoking, alcohol use, a number of environmental factors, and a family history. Now, if found, treatments might include surgery, radiation therapy, and chemotherapy. Importantly, young people, like everyone else, should communicate with their doctor if they notice any rectal bleeding, unusual stools, changes in bowel movements or in their energy, or feelings of tiredness. And notably, the recommendation to have a colonoscopy changed from starting at age 50 to starting at age 45 because more young people are being diagnosed with colon cancer. So again, we're seeing a higher rate of colon cancer at earlier ages, and so this is something for younger and younger people to be aware of. Okay, so in the last few slides, I want to mention some additional sexual health issues that are important to be aware of. So you may have heard of toxic shock syndrome. Now, this is a rare, life-threatening complication of certain types of bacteria, the most common of which is Staphylococcus aureus. Toxic shock syndrome may occur from a variety of different scenarios. So these may include a recent surgery, the use of a contraceptive sponge, diaphragms, or superabsorbent tampons, or having a viral infection. Symptoms of toxic shock syndrome include sudden or high fever, diarrhea, low blood pressure, severe rash, shock, or renal failure. Now, if the symptoms are experienced, or if you experience these symptoms, you should definitely see medical attention right away. It's quite dangerous. Another common sexual health problem is vulvodynia, which is chronic vulvar pain or discomfort of or around the vulva with no definable cause for 3 months or more. Vulvodynia can lead to painful sexual intercourse and may lead some people with vaginas to become abstinent. So, once diagnosed, a variety of treatment options are available, including topical medications, drug treatments, pain relievers, and antidepressants. One of the most common gynecological disorders is endometriosis. This is a disorder in which the endometrium, or the lining of the uterus, grows outside the uterus. The symptoms include pain, spotting or bleeding, and infertility. Unfortunately, there isn't a cure right now, however, symptoms can be minimized. Additionally, women can experience polycystic ovary syndrome, which is a common hormonal problem for women of reproductive age. Males also can experience health issues that can affect their sexuality. One is prostatitis, which is a painful swelling and inflammation of the prostate gland. So again, this is different from prostate cancer. There are a number of causes of prostatitis, including bacterial infections, and some males may have it but be asymptomatic. So treatment for prostatitis can include anti-inflammatory agents, antibiotics, and or alpha blockers. Okay, so finally, let's just briefly discuss COVID-19. So, as you know, COVID is an infectious disease and presents as mild to moderate respiratory illness. Since 2019, when it first reported, the COVID-19 pandemic has impacted just about every part of people's lives, including their sexual functioning. Now, because COVID-19 compromises the cardiovascular system, central nervous system, and pulmonary functioning, there may be a decreased blood supply to the genitals, and studies show that COVID was associated with impaired sexual functioning as well as decreased sexual activity. So there's still very little that's known about how long COVID influences sexual functioning. By long COVID, I mean people who have been diagnosed and continue to experience symptoms with COVID for 1 month or more. So we really need more research to understand the effects of long COVID on sexual functioning. Okay, and that is the end of this lecture.